Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. We know that healthcare and the economy as a whole are facing a new set of normal, and it's unlikely that we're going to return to pre-COVID operations anytime soon. But for many industry leaders, the crisis also presents an opportunity to fundamentally change the way that care is delivered. I'm excited to be joined by one of those thought leaders today, Karen Murphy. She's Executive Vice President and Chief Innovation Officer at Geisinger, the large integrated delivery system based in Danville, Pennsylvania. Karen, thank you so much for taking time out of your busy schedule for being with us today.
My pleasure.
So as I said, we're facing a new set of normal in healthcare and the economy as a whole. A lot of organizations, a lot of providers are starting to bring back some of those elective non-COVID procedures. I know at Geisinger, you've gone a step further to try to think of what a post-crisis world might look like. You wrote about it a little bit in the Harvard Business Review recently. Talk to me about how that process is unfolding at Geisinger. How are you thinking about post-COVID and not just bringing back services?
So, Matthew, I think it was probably the second day of the dramatic shutdown of our business as we knew it to be. Our President and CEO, Dr. Jae-Won Ryu, came and said, I'd like you to lead up the work that really brings us out of this period of time in a much stronger, better way. We have to make this count. So we don't want to just flip the switch and come back. We really want to take this opportunity to transform our enterprise into something much different. So we gathered leaders while they were actually battling the crisis. We gathered leaders together, created 11 work streams across the enterprise, and met weekly, sometimes bi-weekly. And we started with the idea of what did we stop that we don't want to restart? What did we start that we want to continue and expound upon and really expand? And then what other ways can we be transformative as we face this and what we're calling now post-crisis, because we're not saying post-COVID because COVID is going to be with us for a while.
What are some of those things that you looked at and you stopped and realized that you don't need to keep doing anymore?
So very interesting that we looked at everything from meetings that we were having in-person meetings, large gatherings across the enterprise that we said, not only do we not want to do them in person or virtually, they're just not necessary. We also stopped. We also decided that we wanted to really focus on virtual everything across the board, like many other organizations. So not only virtual care, but virtual interviewing, we started virtual communications across the enterprise, and have really looked at every aspect that we could to try to be transformative. So 4 senior leaders and myself are going through all of our activities, our standing committees, and really trying to transform the way we do business. One thing that was very clear to us was this magnificent orchestrated way that we all focused on the problem at hand, which was protecting our patients, our Geisinger family members, and our communities. And we really wanted to, we took down all the silos like many other places, but we're really trying to study culturally how we can inculcate that focus into everything we do as we move forward in our new normal. So not easy to do when you return to businesses as usual, but we're really focused on trying to make that make our the way we interact with each other really lessen the bureaucracy and be much more focused and strategic as the way we approach our work.
Hey, that's interesting because I think, a lot of people would look from the outside and, we write a lot about Geisinger and we hear a lot
Mhm.
about Geisinger. And I think from the outside, people would assume that a lot of those things were in place already. And I'm sure they are, but it sounds like you're taking it to even another level, even for a place like Geisinger.
You can always do better. And when we look at that's what we do, we strive to do better. And we do think there's a new level that we can go to. And we're committed to
Yeah.
doing just that.
So let's talk a little bit about the remote technologies, telehealth.
Mhm.
You referenced some of the staffing stuff, and if you want to talk about that, that would be great. But Geisinger, again, has been at the forefront of this for a while, telehealth. What lessons have you learned about applying remote technologies, especially to some of your rural facilities?
So we have recognized obviously the broadband issue in some cases, but there has been a couple of really interesting findings. We always assumed we have a very elderly population across our entire footprint, and we're trying to figure out, was it because of safety that telehealth was really embraced by our elderly patients. They gave very high reviews after having the experience, and were very appreciative of being able to connect with their physician or their provider using virtual care. And that really energized us because we've been looking at for about the last year on how can we manage chronic diseases in a different way than the traditional face-to-face case manager. So we had been really studying this issue, and really just have accelerated over during the COVID period, and really recognize the need that we have to be able to to provide access to our patients through a variety of channels.
So, are there avenues as you look forward? Geisinger's got a health plan, so you're able to facilitate some of that innovation. As you look at dealing with other payers, even government payers, as we revert back to, once the national emergency is over and some of these telehealth relaxations go away, how worried are you about sort of falling backwards?
So I think it's a concern. So the I think the another problem with telehealth was exactly what the issue that you raised, and that being the lack of parity of payment. And one thing that has become crystal clear to, I think, the industry as a whole is that the fee-for-service system just doesn't work in any scenario. And in the COVID situation, we did everything right. We stopped the elective work. We relied very much on virtual communication with our patients. Um, we protected, we really walled off um, the enterprise to protect our communities and our Geisinger family, and have, as a result of the fee-for-service model, have certainly suffered significantly. So we are definitely forging ahead with advocacy efforts and also our other payers to work on a much more prospective, value-based payment than what we have lived under previously.
We're seeing that advocacy, happen nationally,
Mm-hmm.
happen in Washington. Certainly, some of the primary care practices are beginning to talk
Mm-hmm.
more about sort of capitated models, getting
Mm-hmm.
away from fee for service. You have experience in the government arena, so
Mm-hmm.
how optimistic are you that this crisis could be used to propel value-based, outcome-based payment further than we had been doing?
So I think if not now, when? We've just had a glaring. We've worked at it for the last decade, right? To go to value-based payment, and we've had some successes. I'll certainly give a plug for the Pennsylvania Rural Health Initiative, the Maryland all-payer model, which I worked on, both at the state and the federal level. And clearly, while they're not perfect, and there are certainly modifications that we can make that would enhance their effectiveness, I think those models really provide incentives for providers to really offer the right care in the right place and improve outcomes as a result.
Great. I want to come back last question here, Karen, on you referenced the staffing, I guess doing virtual interviewing, things like that. I think in the Harvard Business Review article, you said about 30% maybe of your staff could be remote. What does that do for an organization the size of Geisinger? How do you start to deal with integrating that staff into operations if everybody's remote or that percentage is remote?
So that percentage, and we've done it rather, it has been shocking. We've done it rather effectively. So work from home, really important. Another finding for workforce that we encountered was the ability, so as most health systems did, we redeployed staff to other areas. And what we found was very interesting, that many of the redeployed staff felt very invigorated with the change of scenery and the new experience. And we're really going to take a look at that at Geisinger and say, how do we manage our workforce in a much more strategic way that will result in not only really a higher job satisfaction and also what we think a more well-informed workforce. So that, again, is another silver lining for us.
Got it. Well, Karen, we appreciate you taking some time. I know these are busy times for you, but we appreciate you carving out a little time for us here at Modern Healthcare. Thanks. We'll want to stay in touch with you on some of this stuff and be safe.
Thank you, Matthew. You as well.
And now I'm excited to bring on our technology reporter, Jessica Kim Cohen. Jessica, hello. How are you?
Hi, I'm good. How are you?
Good. I'm good. So you heard we talked with Karen a little bit about telehealth and what they've been doing at Geisinger. You've been doing a lot of reporting on how telehealth is being used during the COVID crisis. What are some of the things you're hearing from your sources in terms of just going forward as we begin to move out of the first wave into summer and then into a potential second wave?
Yeah, from a telehealth perspective, it's been really fascinating. Everyone in healthcare knows for years we've been hearing that this is going to be the year of telehealth, or next year is going to be the year of telehealth. And to see that, now we see organizations that are going from doing just a few dozen telehealth visits a week to now doing multiple thousands per day even. It is just shot up exponentially. And I think the question we're seeing now as health systems are starting to reopen for non-emergent care, is that level of telehealth engagement going to stay up? Is it going to go down as more patients want to be seen in person? Is telehealth just going to be forced to not be as viable in the future if the current level of reimbursement and parity we're seeing for payment right now declines in the future? There's a lot up in the air that providers are looking at and just trying to figure out, what will the new normal be? Will there be a shift to more virtual care, or will we revert to what we might have seen closer to in the past?
How worried do you think folks are about, reverting back to regulatory-wise, reverting back to where they were pre-COVID?
There is a fairly big concern there, just because the phrase that people like to say is the genie's out of the bottle now, can't really put it back. If there are patients who might have been getting telehealth services the past few months, might have enjoyed that and come to expect that, when that disappears all of a sudden, that's going to be potentially upsetting from a patient perspective. There's also providers who might not have tried it before and now like this way of doing care, and movement back would be not so great to see there. So we are seeing a lot of providers wanting to know what's coming next from the regulatory perspective and what they should be preparing for.
Right. And then lastly, Jessica, you did a story a few weeks ago, about a month and a half ago, I think, on innovation, one of our CEO Power panels, where you looked at how the COVID crisis might be impacting innovation across health systems, some delaying some of their innovation center work, some moving forward. Where do you think we are now in terms of organizations being able to move forward with some of the things they had planned to do pre-COVID?
Mm-hmm. Yeah, that was definitely really fascinating. For our CEO Power Panel survey, we had surveyed some of the major hospital CEOs to see what they thought about innovation in the wake of COVID-19, and most said that innovation had either sped up and delayed, just because so much of the innovation was directly focused on addressing the crisis, telehealth, remote work, remote patient monitoring, and some things like integrating AI or doing an EHR upgrade had to be put on the back burner. And for now, it does seem like most hospitals and health systems are still focused on, really dealing with the crisis, and now dealing with the next phase of the crisis, figuring out how to get patients safely back into hospitals, whether there are ways to have patients check in remotely, or have virtual waiting rooms outside the facilities to make sure that people aren't exposed in any ways that they don't have to be. So some of those innovation projects that might have been planned for this year back last year still seems like they're delayed but not canceled.
Right. Got it. Well, Jessica, thanks for joining us today. We'll be sure to look for more of your coverage in the magazine and online.
Great. Well, thank you so much.
Sure. And thank you all for tuning in to the checkup. Be sure to come back and see us next Monday, June 29th. I'm Matthew Weinstock with Modern Healthcare. Stay safe, everyone.